So thank you, gentlemen of the press. I think we'll start with Amaka's question. You asked some states were discharging patients and declaring themselves COVID-19 free. No state, no single state in Nigeria is COVID-19 free. Not one. No country in the world is COVID-19 free. Even New Zealand, there's an island state, is still having new cases after a period of not having any. We can't separate ourselves from the rest of the country. We live in a context. Viruses spread. It's the nature of them. So right now, no state is COVID-19 free. That's why we have to keep doing this work that we're doing, testing people, finding out if they have it. Even if you don't have it, you can spread it. So even if you're asymptomatic, you live with others that are more vulnerable, that can get very ill if you get it. And that's the responsibility that we all have. And that's why prevention is very important. If you can't prevent, you detect. And it is that detection that we call lab testing. And that's why we have to scale our lab testing. So even if some of us are lucky and get away with having asymptomatic infections, we have to test more. So really, we can only start thinking and talking about any state, any community being disease-free when we have an effective tool to fight that disease. That will come when we have a vaccine. Until then, there's no easy way to say this. We have to keep pushing on these preventive measures. We have to develop our laboratory capacity to test. And either you start testing now or you start testing later. But eventually, we will all test. That's for sure. Mitare, your question was on TB and COVID and whether we could, why we're using the same equipment, GeneXpert, for both. GeneXpert is just a modern way of doing PCR testing. It's a new way. We had TB as a problem. You combine it into a cartridge, and you plug that cartridge into a GeneXpert machine. It avoids the long processing time and gives you a result. So it's a very cute way to develop of expediting that PCR process. That has now been adapted for COVID-19, but the cartridges are different. So the cartridges you use for TB are different from what you use for HIV, which is what we've been waiting for. We had the GeneXpert equipment for a long time. What we didn't have was the cartridges for COVID-19. So it's fairly straightforward, and it's a beautiful technology for lab people. It avoids all the difficult dilution that you need to do when you're doing conventional PCR. The problem is you can't do too many samples at a time. So it's easier, it's closer to patients, but it can't process the volumes that we can with the conventional methods. Rachel, I think you had 3 questions. You said I didn't speak about challenges, sorry, at the state level. Where are you? Okay, there, yes. We didn't speak about challenges there were lots of challenges at the states. Our responsibility when we go to states are to have a robust conversation with the states in their states, point out their challenges, but really it doesn't do us any service to come out and talk about challenges. We identified a few challenges, but on the average, these 3 states, and including Lagos, of course, we've talked about several, are actually doing well. And we learned a lot from them that we now want to take to other states to show. And that's really the value of going to these states, to share information, to understand what they're doing, gaps and learning opportunities. We have 37 states in Nigeria, different levels of resources, different challenges, different contexts that they work in. Your other question was on turnaround time. If you look at the turnaround time, they have really gone down in many places. In many places in Abuja, you get your result in 24 hours, sometimes a day and a half, generally. The testing itself takes 8 to 10 hours, but you remember it takes some time to get the samples to the lab and get the results to the state. Now, at the moment, it's very difficult to reduce the testing period to more than 7 hours for conventional and more than 3 hours for GeneXpert, right? The technology just doesn't allow that yet. And that's why we're all looking for a rapid diagnostic test kit that works. We've assessed a few. The Medical Laboratory Council of Nigeria has done a few assessments. None of them have worked sufficiently yet. But we'll keep trying. Efforts are going on around the world. I don't come out here to tell you these are the three, but there are many efforts. Every country is looking for the same thing. So once we get one that works sufficiently, this will really change the landscape of the work that we do. And I know that a lot of hospitals is very frustrating for many people because of sometimes there's anxiety about treating people until you know their status. These are challenges every country in the world is facing. But our short-term strategy is to ensure access to the tests that we have. And that's why we're rolling out GeneXpert very aggressively. In the next week or so, we'll be able to say that there's access to testing in every state in Nigeria that wants to. We're nearly there. I think there are about 6-7 states that don't have a testing facility yet. There are some that are in progress. They're mostly using the GeneXpert technology. So by next week, we will say that the country is covered. So the challenge will be, of course, some states are